السلام عليكم طلابنا. نتواصل مع المحاضرة السادسة للإندوكراين. وصلنا إلى نقطة تخصنا يعني بالفارماكولوجي link to pharmacology. sulfonylurea, glipizide and glyburide are pharmacological agents that bind to and inhibit the ATP sensitive potassium channel. Sulfonylurea therefore stimulate the release of preformed insulin stored in the vesicle, which result in reduce the blood glucose concentration. Sulfonylurea do not cause an increase in the insulin synthesis. نقطة هاي لازم نركز عليها. The mechanism of insulin secretion هنا موضحة بهذا الرسم البسيط والحلو. هنا الشوجر جلوكوز نقله إلى داخل، بعدين راح يساهم في عملية الأوبنينج of the potassium. After that the calcium will be increased inside. By the process of exocytosis, the insulin will be outside of the B cells. How the insulin secretion is controlled? Control of insulin secretion, blood glucose concentration is the primary. Regular insulin secretion, an increase in the blood glucose concentration stimulates the insulin secretion. The action of insulin reduces the blood glucose concentration back to the normal, thereby inhibiting further insulin secretion. من يبدي ينزل السكر طبعا وحده يوقف بعد السكريشن of insulin. Other factors and conditions that increase insulin secretion are amino acid increase, fatty acid concentration also increase, glucose, so increase in the amino acid, increase in the fatty acid, and increase in the glucagon, cortisol. All of these increase the level of the insulin. Sulfonylurea drug and also obesity. While low glucose concentration fasting, somatostatin, and alpha-adrenergic agonist usually decrease the insulin secretion. Parasympathetic nervous system stimulate the secretion of insulin. Sympathetic nervous system inhibit the insulin secretion. Insulin secretion increase markedly in two stages. Plasma insulin concentration increase almost tenfold within 3 to 5 minutes after the acute elevation of glucose, of blood glucose. This results from immediate dumping of the performed insulin from the beta cell of the islet of the Langerhans. About 15 minutes, insulin secretion rises as a second time and reaches a new plateau in 2 to 3 hours. This time is usually at a rate of secretion even greater than the initial phase. The secretion results both from additional release of performed insulin and from activation of enzyme system that synthesis and release a new insulin from the cells. هنا المخطط اللي نشوفه يا شباب هسه في عملية صعود الإنسولين. شوف ورا 10 دقائق يبدي يصعد ويرجع مرة ثانية يصعد لنا أيضا مرة أخرى. فنشوف احنا عندنا 2 crises of insulin secretion after taking meal. Glucagon, a peptide hormone produced by alpha cells of islet of Langerhans. The overall effect of the glucagon include increased hepatic glucose production, glycogen lysis, gluconeogenesis, stimulation of lipolysis in the liver and adipose tissue. The effect of glucagon on glucose metabolism are generally opposite to those of insulin. Acting primarily in the liver, glucagon stimulates glycogen lysis, breakdown of glycogen, the storage form of glucose, and gluconeogenesis, which increase the blood glucose level. This hormone also stimulates the lipolysis, which increases the circulating concentration of the free fatty acid. These molecules may then be used as alternative energy source by muscle or severe glycogenesis, genetic substrate in the liver. Finally, the glucagon simulate the hepatic uptake of amino acid, which also serve as a substrate for gluconeogenesis. Factors that stimulate glucagon secretion, including decrease in the blood glucose and increase in the blood amino acid, and sympathetic nervous system stimulation, stress and exercise. Factors that inhibit glucagon secretion, including of insulin and an increase in the blood glucose. Other factors which affect glucagon secretion are fasting, CCK, creatinine kinase, and beta-adrenergic agonist, while insulin and somatostatin decrease the glucagon secretion. Factors that stimulate glucagon secretion, including decrease in the blood glucose and increase in the fatty acids, as I said in the previous word. هنا نشوف إعادة صارت لي الجملة، وهنا خوش هنا مبين عندنا العوامل اللي زين والعوامل اللي تنقص. فهنا الفاكتور شوفها glucose oxidation, glycogen synthesis, fat synthesis, promote protein synthesis. This is the action of insulin. While the glucagon, glycogen lysis, gluconeogenesis, and ketogenesis. الديفكت اللي يصير عندنا بالبنكرياس والإنسولين secretion, it will lead to a disease which is called diabetes mellitus. Diabetes mellitus is a group of disorder involved in the regulation of insulin production or secretion or in the cellular action of insulin. The result is hyperglycemia. Diabetes mellitus characterized by hyperglycemia, polyuria, increased thirst, and fluid intake. The expert competent of the diagnosis and the classification of diabetes mellitus divided into type 1 diabetes. طبعا الحقيقة احنا ما نريد ندخل في موضوع شرح الأمراض والباطنية، لكن في معلومة بسيطة which is type 1 diabetes, which is characterized by destruction of the pancreatic cells, beta cells, and an absolute deficiency of insulin, account for 5% to 10% of those diabetes patients. And the second is called type 2 diabetes mellitus, non-insulin dependent diabetes. It currently accounts for about 90 to 95% of diabetic patients. Third type is called gestational diabetes, which is usually occur during pregnancy, and other specific type of diabetes which may be occur secondary to other conditions like Cushing syndrome, acromegaly, and pancreatitis. الحقيقة خلصنا من موضوع البنكرياتيك اندوكراين. إن شاء الله في الأسبوع القادم راح نبدي الريبرودكتيف سيستم إن شاء الله.